Welcome to another episode of SWOO Morning here on SWOO, the first program of a kind in the Middle East, and the program that helps viewers all over the world to follow us wherever you are. I'm Jennifer Sarah, and of course today we have again amazing guests and great tips for you. First up, our hands and wrists play a major role in our lives and also in very many careers. Doctors, artists, lab assistants, and of course, professional athletes. And today I have our first guest with me, Dr. Lucia Heras, consultant orthopedic surgery specialist in upper limb cases from Bujir Hospital for Advanced Surgery, Dubai, to talk to us about wrist problems, hand problems, the cause of them through, for example, excessive mobile phone use and keyboard use, and most importantly, how to avoid them. Welcome and good morning.
Good morning.
Thank you so much for joining us.
Thank you.
Can you tell us something about the main causes for wrist problems and hand problems?
The main problem normally is ligament injuries, and it's very much related with the sport.
Okay.
You can have a ligament injury when you fall, like playing football or fall from a motorbike, or when you go into the gym and do weightlifting or even boxing, you can also damage your ligaments, or repetitive exercises or movement when you're doing, for example, play golf. Mm-hmm. All this with time can damage the ligaments, and this is a big problem in wrist.
Okay, so for example, you can have an injury from falling and
That's right.
catching yourself with the hand, but also if you're just lifting weight and nothing happens just through
bad technique, too much time, the muscles get weak, and then the ligaments go away and then get damaged.
And do you then notice a sudden injury, or is it just with time it's getting worse and worse?
When the situation is acute, like a falling over or something like that, then it's an acute injury.
Yeah.
You feel it straight away, the inflammation. When it's a chronic thing, you tend to find one day that it's more painful, more swelling, then settle down for a while, and that is one of the more problematic issues because patients tend to come to the clinic too late.
Too late. Okay, so basically as soon as you feel problems in your wrist, in your hand, then you should go to and have it.
The sooner the better, yeah. Much easier treatment if you come sooner than if you come later, actually.
And do genetics play a role in how likely you are to get
in ligaments? There's two issues that can play a little bit of a role, no a big one, but some people has very lax ligament, we call ligament laxity, and in that case, your joints are more unstable, so more prone to injury, or some mismatch of the bones. So this produces stretching the ligament and also can make it much easier to have an injury.
Okay. And what about nowadays? We use our mobile phones all the time, where we're on the laptops, on the computers all the time. Does that have a strong effect on injuries? Do you see?
Yeah, but this doesn't affect the ligament. Ligament mainly it just stabilize. There's a tissue that stabilizes joints. Also.
Okay.
The problem we have with mobile phones or computers are tendinitis. The inflammation of the tendon. The tendon, when you're doing the same movement on and off for a long period of time, become inflamed. I mean, there's a very extended problems with all these mobile thumbs movement that sooner or later produce tendinitis, and sometimes very severe and chronic and difficult to deal with.
Okay. You brought us some hands today.
Yes.
Can you demonstrate where the main problems arise and what we can do to avoid them?
In that one you can see probably the ligaments. One of the main ligaments we have in the wrist is in that part, uniting the big bone with the ulnar side in that part of the wrist.
Yeah, okay.
Okay, this is the one that a rotating movement when you hold things, playing golf can get damaged.
Okay.
And this is called TFCC, triangular fiber cartilage complex, and it's very important to be repaired. And the other one, very important, is between these little bones in the carpal, around this area.
Ah, okay. Mm-hmm.
Yeah, very typical of falling over, boxing, weightlifting, And a patient comes with a typical pain in there, unable to do push-ups or stand up from the hands. And also this one, if it doesn't heal, gradually produces deterioration of the wrist and arthritis, which is very important because it starts happening in young patients.
And what can you do to avoid it, and what is the treatment?
To avoid it, mainly you need good training, to know a little bit of the hands, do a lot of stretching before the exercises, after the exercises, taking breaks regularly, and don't go over the time that you're supposed to be doing the exercises.
Okay.
I mean, if you train to do 10 minutes, you shouldn't go and do 20 minutes because sooner or later the ligament will fail.
Yeah.
And treatment depends on the stage. If they come as acute injury, 6 weeks in cast, most of the time makes the ligament heal.
Okay.
Problems, most of the time comes later, and when it comes later, we have to operate it, and the operation is just to fix the ligament back.
But if you have it in a cast for 6 weeks, does it not make it stiff then?
It will make it stiff, but that doesn't matter as soon as you follow with a hand therapist to rehabilitate the wrist.
Okay, so then after that you have to do physiotherapy to get it back.
Even with the surgery, you have to do physiotherapy. Okay. Part of the good results of the hand surgery is the hand physiotherapy.
And in what cases is surgery needed, or is surgery never
mainly when they come late.
Okay, so don't come late.
If you come in the first 2 to 3 months, you still have a chance to have this treated with conservative management. After that, then the chances reduce, and sometimes they come 2 years later. So there's no chance whatsoever.
Okay. And is there a certain muscle that we can train to support?
Yeah, if the injury is in that ligament, and this groove you have seen in here, we have a tendon, which is that one, and extend the wrist. We normally do some stretching exercises, reinforcement exercises of this tendon to protect that joint.
Okay.
And that's things you can do before playing golf, for example. You do some strengthening of the wrist, and then they will improve the protection of the joint when you're doing the sport.
And what is this here? What
this is the tendon for the tendinitis. That's the thing. I mean, that's the flexor tendon, very typical of keyboards, motion and things like that. And
what is this? A yellow?
This is the median nerve. That's the nerve we have to supply these 3 fingers, this part of the hand. Okay. And this is probably people heard about the carpal tunnel. This is the carpal tunnel. So tendinitis, inflammation, synovitis, any inflammation in this tunnel, which is very, very narrow, the first thing it produces is damage to the nerve. Then you start feeling all tingling, some pins and needles, and you cannot sleep at night because it becomes numb.
That comes from keyboard use?
It can come from keyboard use. Okay. Yeah. One important thing on keyboard, you need always to rest the wrist and break often as well.
So you rest the wrist while you're typing?
Yeah. I mean, that's right. First of all, you need the hands in the table, and then something to support the wrist. You shouldn't be supporting the wrist like that because sooner or later the muscles kick away.
So basically what I do all the time. Okay, I've definitely learned something for myself as well. And what is this red part here?
This is the muscles to the thumb. That thumb is the more involved in all the movement you're doing with the telephone, the mobiles, and
so people have problems here as well?
Having inflammation, yeah.
Okay.
And in children, the teenager with all these Game Boys and all this, that is terrible.
So how many hours a day would you say is one, or how many hours, after how many hours should you be like, okay, I'm putting away my mobile phone, or I'm putting away the computer, I'm going to take a rest?
You shouldn't do repetitive movement for more than 45 minutes continuously.
Okay, so basically for people who are working with the computer and need it,
it needs to break every hour maximum, take 10 minutes, do some stretching exercise of the tendons, things like that. And at the end of the day, if it's 8 hours working with the computer at the same time, then you need to do a little bit of stretching to relax the muscles. You know, gradually with time, it reduces the inflammation.
Okay. And what about massages? Does that help? Because I do enjoy a good hand massage.
Massage is very nice, but Massage is basic in relaxed muscles.
Okay.
The problem we have in hands and wrists is we don't have muscles.
Okay.
The muscle we have are very, very small. So massage works in other parts of the body, but in the wrist it doesn't work. Normally, the thing we're doing is reinforcement, stretching exercises of the tendon, reinforcement tendons, things like that, because this is the only thing you have in the hand, no muscles.
So basically, the solution would be to stretch regularly, to take breaks.
I mean, most of you see the people going to the gym and do a lot of stretching on the legs. None of them do a stretching on the arms.
True. I never do either. Actually, that's very right.
Before the gym, neither after the gym. So this is a big problem because those days, what they're doing, weightlifting, boxing, push-ups, things like that. I mean, you use your upper limb where you know stretching it, and that is the problem.
Okay, so always remember to stretch and to take breaks and never to go above your limit.
Yeah.
And maybe you want to give your hands and wrists a break and take a vacation. If you want to know where to go, then I'll let you know after the break with our travel tip. Thank you so much for being here, Dr. Lucia.
Thank you for having me here.